Hai, Assalamualaikum. My name is HANISAH AMANINA binti MOHAMAD KHAIRUDIN, and I'm going to talk about the introduction of disease of the respiratory system, which is chapter 10. So first thing first, I'm going to introduce about ICD-10, which is the International Classification of Disease 10 Revision Clinical Modification. So basically, ICD-10 is a standardized system used to code diseases and also medical condition, which is morbidity data. Most of healthcare providers use ICD-10 codes when diagnosing patients. So next, I'm going to talk about respiratory system or diseases. So respiratory systems or diseases are conditions that affect the tissues involving in breathing, which include your lungs and your airways. Chronic or long-lasting respiratory diseases are common throughout the world. In fact, researchers have estimated that 544.9 million people in the world had a chronic respiratory disease in 2017. An example of chronic respiratory diseases is asthma. So asthma basically is an inflammatory disease that can affect the airways of your lungs. So it can make difficult in breathing and can make some physical activities challenging or even impossible. So, asthma occurs because of the inflammation and mucus in lining of your airways. During an attack, this inflammation causes a wheezing or whistling sound when you breathe, along with other symptoms. So the type of asthma you have can determine which symptoms you experience. So next, my friends will explain to you guys the symptoms and also the type of asthma that you can experience. Some people may experience symptoms consistently throughout the day. Others may find that certain activities make their symptoms worse. But not everyone with asthma will experience these particular symptoms. If you think the symptoms you are experiencing could be related to a condition such as asthma, so you should make an appointment to see a healthcare professional. If you have asthma, remember that even if your condition is well managed, you may occasionally have a flare-up of symptoms. Flare-ups often decrease with the use of quick-acting treatment such as inhalers, but may require medical attention in severe cases. That's it from me, so to the next point.
Hi and Assalamualaikum. My name is NADZIRAH binti NIZAM. I will explain about the causes of asthma. As you all know, asthma is caused by combination of genetic, environmental, and immune system factor. This factor can contribute to airway inflammation, sensitivity, and narrowing. One of the causes of asthma is environmental trigger. It is because exposure to allergens such as dust, pollen, and pet can lead to asthma. Some irritant like cigarette smoke, air pollution, or strong odor or chemical fume can aggravate this condition. The weather change also like cool air or high temperature can also act as trigger. Besides that, the asthma can cause by respiratory infection. The viral infection in early childhood such as the flu or respiratory syncytial virus RSV, which can damage the lung and make the airway more sensitive. After that, immune system overreaction can be factor of asthma. In some cases, the immune system overreact the harmless substances like allergen that causes inflammation in airway, which is rhinitis. In addition, caused by occupational and lifestyle factor. It is because in certain work environment, for those involved in exposure to dust, chemical or fume can cause asthma. For those who are exposed to cigarette smoke, especially during pregnancy or childhood, can increase this risk of asthma. Lastly, because of genetic. If you have a family history of asthma, allergy, or eczema, you are more likely to develop asthma. The specific genetic variation can make the immune system more reactive. Okay, now for this slide, I will continue with symptoms of asthma. Firstly, shortness of breath. People with asthma often feel like they can't get enough air and difficult to breathe. This symptom is more noticeable during physical activity at night or when exposed to asthma triggered like allergen or cool air. The second point is wheezing. Wheezing is a high-pitched whistling sound that occurs when breathing out. It happens because the airways are narrow, causing airflow become turbulent. This is one of the hallmark symptoms of asthma. The next symptom is persistent coughing. Asthma-related coughing is often persistent and dry, though it may bring up mucus in some cases. It tends to worsen at night, early morning, or after exposure to triggers such as cool air, allergen, smoke, or exercise. Then, chest tightness can be occur. Many people with asthma describe the sensation pressure of chest as a band squeezing around their chest. It's result from the airway muscle tightening and the increased effort needed to breathe. It will lead to heart racing, which is known as tachycardia. Last but not least, trouble or sleep. It happens because asthma symptoms like coughing, wheezing, and shortness of breath tend to worsen at night. This can lead to fatigue where feeling tired or weak due to effortful breathing.
Assalamualaikum and hi, my name is IZRA KARMILA binti ROSLAN. I will be presenting about complication of asthma. Asthma can lead to several complications, short-term and long-term. For short-term complication, it consists of asthma attack, respiratory infection, pneumonia, sleep disorder, increased use of rescue inhaler, increased heart rate, and panic attacks. The first one is asthma attack, which can happen sudden worsening of symptoms that causing severe difficulty in breathing. For example, a person may experience an asthma attack triggered by exposure to allergens. Secondly is pneumonia, which are infections that inflame the air sacs in one or both lungs. Next is sleep disorder like obstructive sleep apnea, where patients experience frequent nighttime awakening. Next one can cause increased heart rate that can be seen during an asthma attack. The body may respond to the low oxygen level. Lastly is panic attack, the fear and anxiety associated with the asthma attack that can lead to hyperventilation. Now, let's move to the long-term complication of asthma. For the first one is the mental health condition, where a person with chronic asthma may develop anxiety or depression due to the ongoing challenges of managing their condition, fear of attack, or limitation of physical activity. This can create a cycle where mental health issues further exacerbate asthma symptoms. Second is chronic obstructive pulmonary disease, COPD, for example, especially in individuals who smoke or have a history of several asthma attacks. This can lead to the chronic breathing difficulties and reduced quality of life. Next one is obesity, where limited physical activity due to asthma symptoms can contribute to weight gain and obesity. For example, is a child who avoids sport due to asthma leading to a sedentary lifestyle. Finally, is cardiovascular issues. Over time, chronic inflammation and airway remodeling can lead to a gradual decline in lung function, making it difficult for individuals to engage in physical activities or even perform our daily tasks.
Assalamualaikum and hi, my name is RADZIAH binti RAFAR. My metric number is 2023305859. I will further explain about the treatment and medication of asthma. Preventing asthma attack before they begins require prevention and long-term management. In order to ensure that your drugs are controlling your symptom, treatment typically entails watching your breathing, identifying your triggers, and taking precautions to avoid them. Besides, the right medication for the patient depends on the number of things such as the age, symptom, asthma triggers, and what works best to keep asthma under the control. The medication are divided by two: quick relief rescue medication and long-term control medication. Firstly, during an asthma attack, quick relief rescue drugs are given as needed to provide quick temporary symptom relief. Thus, quick relief drug types include short-acting beta agonists (SABAs) such as albuterol and also levobuterol. It is provide rapid relief by relaxing airway muscles. Secondly, anticholinergics that helps open airways by reducing mucus productions. And last medication for quick relief rescue medication is oral corticosteroids that relieve airway inflammation caused by severe asthma. They can cause serious side effects when used long term. Therefore, these drugs are used only on a short-term basis to treat severe asthma symptoms. Long-term asthma control medication usually given once a day are the primary form of asthma care. These medications help manage your asthma on a daily basis and reduce the likelihood of an asthma attack. The following are examples of long-term control drug types. The first one is inhaled corticosteroid that include fluticasone, budesonide, and circelsonide. It is the first-line treatment to reduce airway inflammation. Unlike oral corticosteroid, inhaled corticosteroids have a relatively low risk of serious side effects. The other long-term asthma control medication is theophylline, a daily pill that helps keep the airway open by relaxing the muscle around the airways. Lastly, leucorin modifiers. This oral medication help relieve asthma symptoms.
Assalamualaikum, I am Nurlini binti Abbas. I'll be explaining about two cases study related to this chapter. First case study is a 70-year-old patient with decompensated chronic obstructive pulmonary disease, COPD. She is admitted to the hospital with acute exacerbation of bronchial asthma. What diagnosis codes are reported? So right now we code J44.1 as the principal diagnosis in this case because the decompensated COPD is the primary reason for the hospitalization. Then we code asthma J45.901, which is acute exacerbation of bronchial asthma, is reported as the secondary because it is the coexisting condition contributing to the patient's clinical presentation. Next case study is a 65-year-old female patient returns to her primary care provider for follow-up of an acute bronchitis with chronic obstructive pulmonary disease. She currently smokes 1 pack a day and is dependent on the cigarettes. What diagnosis codes are reported? The appropriate diagnosis codes reported are J44.0 as the principal diagnosis, which representing acute bronchitis with COPD because this is the main disease that the patient has. And we code F17.210 as the secondary diagnosis, which indicates the patient nicotine dependence, cigarettes uncomplicated. These codes are coded as secondary because it is the contributing factors to acute bronchitis with COPD. That's all from me. Thank you.